The CHAMPION study is a phase 3 trial in neuromyelitis optica spectrum disorder to test the efficacy of Ravulizumab in preventing relapses. Ravulizumab is a complement inhibitor. It's very much like Eculizumab that was already approved in 2019, but Ravulizumab hangs around the circulation longer, just has a few amino acid mutations that allows that to happen. And as a result, instead of requiring an infusion every 2 weeks, it's every 8 weeks. So to prove that this molecule works like Soliris does, the FDA required a trial, and we thought it most ethical to not include a placebo arm, rather to use the placebo arm from the Eculizumab trial that was just recently completed, and then to structure the trial with the same inclusion criteria for Ravulizumab. So that's how it was done. It's a sort of innovative design that allows the use of a previous placebo arm. And that trial it ran for 3 or so years. It recruited somewhere between 50 and 60 patients, and the median duration of treatment is about 73 weeks. And the final outcome, the result, is that there were 0 relapses. So no one in the Ravulizumab treated arm had an adjudicated relapse. And that's very close to the numbers from the Soliris trial. So these were expected. Again, these molecules basically do the same thing. It's just that the new one, Ravulizumab, is every 8 weeks. And so we were really pleased with that. And the safety outcomes were similar. We recognize that inhibiting complement predisposes to meningitis, Neisseria meningitis. And we did have 2 cases, one in the blood and one in the CSF. Both were treated and made full recoveries, but this is something that we need to be aware of. And so that was the trial and the trial design. Now, my presentation was around the subgroup analysis, and these were all pre-specified. Okay, so we thought we were going to look at the relapses in the trial based on things like geography and sex and race and things like that. But in the end, since there are 0 relapses, then no matter how you divide up 0 into all these different subgroups, they all did well. Doesn't matter where you're from, what sex, because there were 0 relapses. It was really hard to break down into these subgroups. So the final, and the same is true actually of the safety. So there were adverse events, of course, and these were recorded, and then we looked at them by subgroup analysis, and there was no predisposing group. It's not like all of the meningitis cases happened in one area of the world or in one sex or anything like that. So there was no real meaningful discovery in the subgroup analysis. Everybody responded well, and it was safe throughout the entire population.